Hey, this is Dr. Christy Mauldin, and today I want to welcome you to this webinar, and I want to give you a little bit of information about neuropathy, the causes, the symptoms, and the traditional types of treatments that are available, as well as some alternative treatments that are not as well known but have really good results, as well as research. First, before we get into that, I want to tell you a little bit about me and what my history is and why I work with neuropathy. So I am a chiropractor and I've been a licensed chiropractor since 1999. I have had licenses in North Carolina, California, and Florida. I'm still licensed in North Carolina. I've had practices in California. I've had 3 practices in North Carolina. And I also have a practice in Italy where my children's father is from. And we live there and go back and forth from Italy and to North Carolina. I still have a practice there in High Point, North Carolina. I have had over 500 hours of continuing education in functional neurology and functional medicine, and I've focused on peripheral neuropathy since 2014 after I saw many patients coming in who were not getting help and were constantly complaining about numbness, tingling, and burning and other types of symptoms in their bodies. So I wanted to find something that would help them. And so I started doing the neuropathy program a long time ago and had really good results. So then I decided to offer it online because I had a lot of people who would come to me and they drove 2 to 3 hours to get there. They would be in my office for another 2 hours for the therapy, and then they would drive home. If somebody is in really good shape, that's not a problem. But the case with these people, sometimes I would hear people say, first of all, they couldn't walk. Second of all, they could not drive because they couldn't feel the gas pedal or the brake. So that's pretty dangerous. They were just in so much pain that they weren't able to endure the trip there and back home. And so it was always challenging, especially if you're coming 3 times a week. And some of these people came anywhere from 4 to 12 weeks, depending on the severity of their neuropathy. With my program now, you're able to get the same machines at home and you're able to do it every single day and twice a day, and you get the results much faster than if you just came to my office. So that's why I started offering this program. So let's get straight into it. So here I am. I don't know if I look like the picture. It hasn't been that long ago. I just don't have my glasses on. I only have the glasses on to see far away. So I'm up close, so I don't need my glasses. So here is a testimonial that someone wrote, and it says, I was so pleased with Dr. Mauldin's neuropathy program. The numbness and tingling in my feet and legs went away. It even improved my balance. Please give her a try. Of course, I did not pay these people to write these testimonials. This is someone who had great results, and actually her results have endured for 5 years, so she's been pretty happy. So let's talk about how does peripheral neuropathy develop. So if you look here, you can see basically there's a brain at the top inside the head, and the nerves, they go straight down the middle of the spine, and then they branch off into little tiny branches that go down the legs. Those are called the peripheral nerves. You have them in your hands and you have them in your feet. So again, this just points out what I was talking about. You have the brain, you have the spinal cord, and you have the nerves, and the peripheral nerves are all the way to the end. Okay, so in this picture, you can see the red arrow pointing to the feet. And then the little picture off to the left of the spine picture, or the body picture, you can see the one on the left, it's a nerve, and that's a normal nerve with the normal myelin sheath. What does the myelin sheath do? That helps as like a covering. It's kind of like a wire on any type of a lamp or household appliance, anything that you have in the house. You have to have that covering on the outside to protect the wires, just like this myelin sheath protects the nerve and allows electrical current to flow across that nerve. If everything is fine, everything works, no problem. Your hands move, you don't feel numbness, tingling, because everything is reaching the hand and going back to the brain without any errors, without any problem or any type of delay. On the right, you see these little chunks that have been cut out of that myelin sheath. And so what happens is the signal is still trying to to reach the end of that nerve, but it gets to where that chunk is and it kind of jumps, so it sputters. And so the signal is not felt the same way as when it's really smooth. So then that's when you start to feel these abnormal sensations. So you'll start to feel numbness and tingling and cold and hot sensations, or like a electrical type of feeling, because the signal is not able to jump or move smoothly. It's sputtering, trying its best to reach the next portion of the myelin sheath, but it's not able to get there. So that's when we start to have degeneration. So when you look at this tree, you see this woman and she's watering this tree. So let's use this as an analogy based on the body. So on a tree, if you water the roots, then the tree will grow. It's pretty simple because it's a living thing and it depends on water and the earth and the nutrients that come from the ground. So the water goes into the roots, it goes up the tree, and then it causes the leaves to flourish and be healthy. So this is the same thing when you talk about the blood supply. So when you have the proper blood supply in the body, the blood is what carries your oxygen, your nutrition. It carries all of the vital components for your body to be healthy. If you do not have blood flow, you're going to have a problem. So just like this, if you don't get water to the roots of this tree, what is the first thing that you'll see happen? The leaves at the top will turn brown, and if it really gets, you know, deprived of water, then the whole tree will just die and it will pull away from the dirt because it's completely dried up. Now, if you catch it somewhere in that process, all you have to do is put water on there and you might give it some miracle grow and the tree will bloom again. So it's pretty simple. With the body, getting back to the roots, so the roots with the blood flow is necessary to get to the nerves. So the leaves represent the nerves. So if you have enough blood flow, then the nerves will be healthy. But if you don't have the blood flow, you're going to have a problem. So that's what happens with neuropathy. You decrease the blood flow, you lose your circulation, and so the nerves just start to wither and they die from the ends. Most of the people who come in with neuropathy, they notice the first symptoms in their feet because that's the furthest point from the heart. Think about the heart. It has to pump blood down to the feet and back and forth. If there's a loss of blood flow, then the nerves start to die. So now we're going to get into the causes of neuropathy. Here you can see a foot and a hand. That's usually where you'll see the first symptoms of neuropathy. Okay, so again, going into the damage of the nerves. So one of the most common things that you associate neuropathy with is diabetes, because diabetes causes decreased blood flow. And so the top picture here, you see this represents a nerve, the yellow part, and the red part is the blood flow. You can see the blood vessel. It goes all the way from the top all the way down to the bottom. That means that that nerve is able to get enough blood flow and that nerve should stay healthy. The next one down, it says diseased blood vessels. You can see that the blood vessel is pulling away from the nerve, and then the nerve starts to have these chunks in it where the blood flow is not able to get there anymore. So the nerve starts to disintegrate and it starts to wither and dry up completely, and then it loses its function. Down at the bottom, it shrivels all the way up. It loses that outer myelin sheath. There's no blood flow. And this is when you start to see serious symptoms of neuropathy. So let's move on. So here are some of the things that can cause it. So poisons and toxins. So one thing here, it could be anything from Agent Orange. You could have chemotherapy from some type of cancer that a person is going through. The chemotherapy attacks the nerve and causes it to die. Statin drugs have been associated with neuropathy because they attack the legs and the circulation in the blood flow going down into the legs that can cause neuropathy. Alcohol is a huge deal. Alcoholism literally attacks the blood flow. It starves the nerves. And I have seen very commonly diabetic and alcoholic neuropathy are very similar because sugar is a poison and alcohol is a poison. So either way, it doesn't matter how the poison is or where it comes from, it still attacks the nerve in the same way. Aspartame is something surprising. So a lot of times diabetics will be told to drink diet drinks because they can't have sugar, but you're replacing the sugar with a toxin, and the toxin also attacks, this is called a neurotoxin. It also attacks the nerve and causes neuropathy, attacks the blood flow. So you have to be really careful about what you put in your body that we'll talk about later. Okay, so now we're going to go into the major problems that can develop from neuropathy. And you see this guy sitting here. He's probably thinking about how hard it is to get up and walk. So we're going to talk about that. Okay, this one is probably the most common symptom that I see. I used to break this up and say numbness or tingling or burning, but I just put it all together. Numbness, tingling, and burning in the hands and or feet. Also freezing. I have some people tell me that they're cold all the time. So it's not just one or the other. Every single person is different and people present with different symptoms. It's not always a cookie cutter case, but you will see at least at some point some of these symptoms. Okay, this one is the most severe, and really I want to talk about this one, dizziness that leads to balance issues and falls. I cannot tell you the number of people who they start saying, hey, I was walking and I tripped over the curb, or I tripped over a stone, or I tripped over the carpet. It's not that. It really is not. It's because your brain has lost the connection neurologically with your feet. And don't discount this dizziness and these falls as something that is not serious. This is very serious. I want to tell you, I just talked to a lady the other day, and she told me that she fell, she broke her ankle, and I asked her, I said, well, how long did it take to heal? And she said, over a year. Now, if you know anything about falls and broken bones, like for a child, for example, or a young, teen or early 20s, if they don't have any health issues, they fall, break a bone, they put a cast on, and they have it for 5 or 6 weeks. It is not normal to not heal within that time. If your body is not healing, it is because you do not have the proper nutrients and blood flow to supply that nerve and the bones of the oxygen and nutrition and everything that it needs to heal. This is huge. So when you go back to the causes of neuropathy, all of those things that I mentioned damage your nerves. And then when your nerves get damaged, the nerves are not able to communicate with your brain anymore. So your brain does not know where your feet are. So I can't tell you again. Another thing is when people wake up in the middle of the night and they try to go to the bathroom, they can't feel their feet. What happens? They fall over. I've had people tell me they hit their head, they get stitches, and they still discount it. And I think, how many times will it take to fall for you to just hit your head and then be dead and nobody finds you? So I really can't stress this enough. I really want to encourage you that if you are having this, you really need to get serious about it. So we will talk about this a little bit more in detail. Another thing that people see is that they might run their bath water and they put their hand in the water or they put their feet in the water and they cannot feel how hot it is, so they get burned. Or they're walking on the carpet and they can't feel the carpet, or they can't feel something in their shoe. They might have a rock in their shoe and they don't know it's there. I have people who've had, the little sensors that you might see in some of the shoes. If you go to one of the discount stores, they put those sensors in there so people won't steal them. And sometimes those things are still sticking in the shoe. I've had people come in and tell me that they did not feel it and they didn't know it was still in there until they took the shoe off and their foot was bloody or their sock was bloody. This is serious as well, so you can't feel things as normally. Okay, this is something that I wanted to bring up because I see this and I have seen it over the years. It's something that I didn't really talk about years ago when I first started the program. It's a sensitive subject, but it's very, very prevalent with any type of neuropathy. And I want to show you why. If you look at this arrow here, this is basically this is a map in the body. I'm sorry, in the brain that shows a breakdown of every single area. Basically, if you've ever seen those surgeries, the open brain surgery, and they stick something and the hand moves, it's because they're trying to isolate this map to find out if they're in the right area. Well, if you look here, genitals is next, it's right, this area is right next to toes and the foot. So doesn't it make sense that if you have problems with your toes in sensation, that you're going to have problems with the genitals? So I want to tell you a little story. So I had a guy, and I'll never forget him. He came in, and he was a good looking guy. And he had a girlfriend, and he was really nervous, and he didn't really want to tell me, but he said, you know what, does this have anything to do with being able to perform with his girlfriend? And he was really nervous because he said she was really pretty, and he just went on and on and on about it. And he was probably, I think, in his 50s. And I said, well, as a matter of fact, and I showed him this exact same map so that he could understand that it's related. And it, needless to say, so I put him on the program, put him on everything, the customized program, did everything with him. And he came in to see me, like, I don't even think it was that long. It might even have been 2 weeks. I don't know. And this man, he took me in the back and he said, I've got to talk to you. And I thought, oh gosh, what's going on? And he told me that everything was normal. And he was very happy, needless to say. And he was thanking me, and he said his girlfriend was thanking me, and he didn't have to take medication, and on and on and on. So I bring this up because sometimes men don't want to bring it up to a woman, or they're just too embarrassed and they don't want to bring it up at all. But this is closely related. If you can fix your toes and your feet, then you can fix that too. So don't give up, okay? You got to get blood flow in this area to also get blood flow in other areas. Okay, so now we want to talk about the brain. So the brain is what regulates all of your sensation, and if there is an abnormal communication going on because the nerves have been damaged, your brain is not receiving adequate information from the feet, and so it's trying to send more signals, but the signals aren't coming back. So what we have to do is retrain your brain so that we can calm down the fire, and then the pain will start to subside. So that's what I do in my program. This is a neurological program that helps to reconnect everything so that your nerves can start to work normally again. Okay, so now we'll go into how is neuropathy traditionally treated from the medical approach, and then we'll go into more about what I do. So here you can see the traditional medical approach. The most common drug that I think that I see people on that come in is gabapentin and amitriptyline, Lyrica, and Cymbalta. So these are probably the main things that I see. Then there's some generic names like Neurontin that I see as well. So people come in with this medication, and I don't know about you, but if you know the history of these, you can also have some side effects that are not very nice. So you have to choose what's worse, the neuropathy or the nasty side effects. But one thing I do want to say is I did not put you on these medications, and I cannot take you off of them. So anything that you do with your medication is between you and your medical doctor, okay? Okay, so I want to go into this a little bit deeper as a disclaimer. Number one, I am a licensed chiropractor, and yes, I have worked with neuropathy for almost 10 years now, but I'm not a medical doctor, and I do not want to be a medical doctor. I did not prescribe the medications to you, and I cannot take you off these medications. This is between you and your doctor. I cannot stress this enough. Do not discontinue anything without speaking to your doctor. You always need to discuss with them before you start a new program. And as what I'm doing online here is I'm a health coach, and I'm giving information that can help you, but you still need to talk to your doctor if you're wanting to change any of your medicines, okay? Okay, now that we have that out of the way, what is different about what I do? So the number one thing that I do is I will order a customized blood work panel for you. So it's probably the most detailed blood work you've ever had, but it gives you a good view of who you are in this moment. I don't know if you've ever had blood work done before, but I'm sure you have. You go, they order 3 or 4 tests, and then if they come back abnormal, they might order some more. The next thing you know, you're already 2 months down the road and you still don't know what's going on. So doesn't it make more sense for us to order it all at one time in this point in time, and we can see every organ, how things are working together, if they're balanced, if there are any issues. So that's the most important thing that I do that I don't think a lot of people are doing with the neuropathy programs. They just give you some basic supplements and they put you on maybe some machines or some exercises or different things. So that is the difference here. I want to make sure that you find out what's going on with you in this moment, and we put you on a program that is customized especially for you so that you can see a beginning and an end to the therapy that we do together, and you can see a change. So what I do with that is I give you a customized diet and a supplement protocol based off of your blood work. And then the third thing is I will give you a customized routine at home that is exactly what I used to do in my office. And this is something that will be yours. You will have these machines for life. You're not leasing them and you don't have to return them and you don't have to leave your house. This is the absolute most, I think, attractive thing about my program now is I don't have to try to convince somebody to drive 3, 4 hours to see me because there's nobody in their area. In this way, I can help a lot more people and you don't have to leave home. You can do this in your pajamas. You can do it in your bed. You can, if you're not even able to walk, you can get yourself working better. So maybe you can start getting out and doing more things. So this is the cool thing about this. The fourth thing that I offer is you have constant email support with me and my staff. So I'm always available by email. I usually, takes within one day, I will get back with you. And at the end, I will go through and do a final customized blood work to recheck everything that we started out with that was abnormal to make sure that you have improvement. This is an 8-week program. So this is something that, doesn't go on for years and it doesn't go on for a week. It is an 8-week program, but it's very intense because you have to do it at home. The only thing that is different is that you have to be accountable for doing this program at home. And if at the end of the program you need to do a maintenance type therapy on yourself, you're going to have to hold yourself accountable. So if anything comes back, it would be on you. But during that 8 weeks, I am completely available with you to look at everything and make sure you're on the right track to get you where you want to be with this whole neuropathy. So here is another testimonial. I had gone to physical therapy and to other doctors for my neuropathy, and they had given up on me. Before I came to your office, I did not have any feeling in my toes, and I had severe pains in my legs and feet. After seeing Dr. Mauldin, now my pain has gone down by 80%, and I can feel my toes on the carpet when I walk, whereas I couldn't before. Donald W. in Lexington. So this slide says that there are some testimonials, but actually they are at another place on the page in this process. So just please look for those because I do have some testimonials that can help you to hear some real life people and what types of success that they've had. Okay, so what do you do now? We're at the end of the webinar, and a lot of people, they get to this point and they say, you know what, either you're one of two people. Number one, you're just not ready yet, and you just want to keep doing what you're doing. You might be doing some creams or trying to eat better, taking some supplements, some generic things. You don't really know what's wrong with you, but you're just doing everything that you can because you're just not ready to commit to a program. Or maybe you've just given up and you just don't think anything can help you. Or you're in the second one and you're like the other people that took a chance who were also in the same boat as you, but they had had enough. And they say, you know what? I don't want to fall anymore. I'm scared that if I fall, I might end up in the nursing home. And if you end up in the nursing home, what's going to happen there? You probably won't ever come out. Like I said with the lady that I had before, she had a fall and it took her over a year to heal. Now, if you're up in age, 70s and 80s, if you have a fall like that, you might not ever come out. I don't try to scare people, but this is the reality of neuropathy. I have seen almost every kind of person walk through the door, and I've heard every story. And I will tell you that I do not accept everybody in my program. I always say that you can lead a horse to water, but you cannot make them drink. It's the same thing with this program. I'm not here to beat you. I'm not here to, make you feel bad. I'm not here to do anything to force you to do this program. I only want the people who have tried things but they didn't work and you really want to see change. Those are the people that I can work with. So I don't want you to reserve the consultation if you don't think that you're going to be a coachable person, because I just don't want to do it. I want to work with people who really want to work with me, because I have seen great results. I've seen people that had almost 100% loss of sensation in their feet, and they were able to regain and get down to below 10% of loss. So that was pretty significant. That was one of the hardest cases that I had, and I honestly told the guy I didn't know if I could help him. He had damage from Agent Orange, from war that he had been in years ago. And the people that I can't help, though, are the ones who are alcoholics. I keep mentioning that because if I tell you to do something and you start feeling better and we get your nerves, the sensation there, but you go out and you keep putting gas on the fire and consuming alcohol, it will not work. And I don't want to mislead anyone. And I sure don't want to sell something to someone if you're not going to be a good coachable person. So, but if you're in that category and you really want to do something about it, then I have a special offer here for you. You can reserve a time with me and we can go over everything. I will go over my programs and what I offer. And it's $37 to reserve the spot. And then we can start working together. But don't do it unless if you're not ready, okay? So that's it for now. I have really enjoyed it and I hope to see you on the other side. Thanks and take care.